welcome. Thank you for joining us for the next little bit. We are pleased to welcome the Westlock Dementia Working Group today. I'll pass off things to Emma here in just a moment. She'll share Westlock's experience and initiative and activities and all the really exciting, heartwarming work they've been doing up there. And if there's time, we'll come back to our provincial team, and Helen and Sharon have a few things to share. All right. Emma, are you ready? All right, I'll stop sharing then, and the floor should be yours.
Okay, everyone's seeing my screen here. You can't see my speaker notes, correct? That was my error the last time I did this presentation, so better to know now than later.
No, it's good. It looks good, Emma.
Oh, I can see the speaker notes.
We'll see.
Oh,
yeah,
cool.
we would see the speaker notes. It's probably on another monitor, Emma.
Yeah, if you go in slideshow mode, you'll just be able to show the slides. So it'll just be your slides and then your face coming up.
No, that's still the slide deck. I think you'll have to back out of presenting in Zoom, and then when it comes up for you, Emma, when you have the slideshow on,
Oh,
there we
you
go.
go. Yep.
There you go.
Perfect.
Let's go. Okay, awesome.
Good.
Hi everybody, my name is Emma Langevin. I am a program coordinator with Westlock and District FCSS, and kind of took the lead on coordinating our Westlock Dementia Friendly project, which is called Building Compassionate Communities. So just to start us off, I wanted to provide a little bit of a background on the project. In our community, the CIDC grant and the CPCLW grant kind of go hand in hand. We're using them to fund one project. So to give a little bit of a background and context, I just wanted to talk a little bit about the history here. So our Aspen PCN here in Westlock applied for the CIDC grant to run a dinner club project. So the intent of that project was to bring together people living with dementia and their caregivers once a month for a dinner to provide some education and some opportunity just for social interaction, peer support, stuff like that. Unfortunately, that project couldn't move ahead. They were able to successfully run one dinner club in, I believe, February of 2020, and we all know what happened in March. So we were kind of sent back to the drawing board to come up with a new project that didn't involve so much like social interaction. So we had to come up with our new project, which we called Building Compassionate Communities. So this project, we came up with our main goals, our objectives, and our ideas at the end of 2021, and we officially launched in 2022. So this project is primarily funded by the CIDC grant, but in order to facilitate our community education sessions, we put volunteers through a training. There's a significant expense involved with that training. And so we supplemented our CIDC grant and the budget we had for volunteer training with the CPCLW grant. So to give you guys an idea of who's involved in this project, the Westlock Dementia Working Group has really been at the core of everything we've done. And this is made up of individuals living within the Westlock region with lived experience, whether that be in their personal lives, professional lives, or both. We're finding that with a lot of people involved in our group. And then also just people with personal interest of learning more about dementia and figuring out what we can do in our community. And so our working group meets monthly to provide project updates, feedback on our different activities, and direct what we're going to do in the future. And the members of this group have really been our community ambassadors for this project. So they've gone out into the community, presented the project to key community stakeholders, So taken different components of our project, information about everything, gone to organizations like pharmacies, doctors' offices, things like that, but also hairdressers, people in the community that have a lot of face-to-face contact with people who may be living with dementia, or maybe caregivers of people living with dementia as well. And so I'll give a brief overview. Obviously, I'm going to focus more on the community education piece for this presentation, but just to give an overall view of the project, I wanted to discuss all the different components. So this project is multifaceted, but we've had three main focuses. So those three focuses being sensory kits, made available to people in the community at no cost, an iPad lending library, and then finishing off with community education. So our sensory kits, we have made these available to people in the community, like I said, at no cost. And these are focused towards people living with dementia who are still living in their own homes. So we have based our sensory kits off of sensory kits we saw in Innisfail, in their dementia-friendly resource kit, and they were inspired by the launch of dementia-friendly ambulances in the UK. And I've included a list of different items included in these kits, primarily just items to encourage brain stimulation, decrease agitation, and increase coping abilities during stressful situations. So we included some activities there, some different items, resource list that we've made of local, provincial, and national resources. So these sensory kits have been an opportunity to incorporate some intergenerational learning. I am technically the youth coordinator with FCSS, and so we try to include children and youth as much as possible. And so some different opportunities for intergenerational learning. We've had a lot of youth help out in assembling these kits. We had a lot of kits to make. And so we've had my FCSS youth groups, the one that meets during the year and during the summer. And we also partnered with the Westlock Alliance Church Vacation Bible School to put together a lot of our kits. So we had the opportunity to merge our working group with our youth group and provide some informal education as well about dementia. Another star of these kits has been the Twiddle Muffs. So if you can see them in that little picture, they're meant to, have different items to fidget with, keep the hands warm. And so this has been another great opportunity for intergenerational interaction. We have Teresa Bechtel, a community member of our working group, and her mother, Shirley, who have been knitting away. They've been our little stars. And so we've engaged a lot of community volunteers, a lot of hours put into these. And especially since this article came out in the AHS newsletter, I'm getting calls from throughout the province about these Twiddle Muffs. So yeah, it has started a bit of a provincial movement for Twiddle Muffs. A little overview of the iPad lending library. So this was another major component of our project. We launched this library August 15th, 2022, and our goal was these iPads to be a one-stop shop for dementia-related tools and information. So the main three components is we've uploaded brain stimulation games to these iPads. We've got a bunch of different apps that are specifically focused on dementia in terms of how to handle emergency situations, how dementia progresses, things like that. And then finally, we had a partnership with our student doctor we had in town last year who came up, he researched a lot of PDF information about dementia, and we've created a library on these iPads for people interested in resources about caregiving, how to speak to children and youth, and just general information. We also have a partnership for these iPads with the Westlock Library and the Adult Literacy and Learning Center to provide tech support for people who aren't very confident in their use of iPads. And these, I should mention, these are open to people living with dementia and their caregivers living in the community. We offer these at no cost, and currently we have the ability to let people rent these out for a month at a time just to get comfortable. And then finishing off, so more specific to this particular grant is our community education. So we knew that we wanted to increase public awareness of dementia in the community. And so once this grant project kind of started to kick off and we were looking into opportunities to provide this public education, we came across the Living the Dementia Journey program offered through the Research Institute of Aging. And this is actually a program where they offer a train the trainer workshop. So you can go through, become a certified trainer, and then offer their overview workshop in your community. And the Living the Dementia Journey workshop is just very focused on shifting our understanding of dementia from kind of that biomedical perspective to kind of a more social and community lens. So it's very focused on changing our negative perceptions of dementia. And it's more so focused for caregivers, learning different opportunities to engage people living with dementia, how to increase their quality of life, and kind of shifting our perception of dementia as, all negative, and looking at the opportunities for growth even after a diagnosis of dementia. So it took us a while to get all of our trainers trained. It's a significant commitment to go through these training sessions. And so now we finally, at the end of October, we trained our last trainer. So our community now has 1 FCSS staff, which is myself, and 3 community volunteers that we've pulled from our Westlock Working Group, who are trained to offer this overview workshop in the community. So the overview workshop is 8 hours worth of content. It's 8 modules. And through offering these workshops, we've tried to bring back the spirit of the Aspen PCN Dinner Club. And so we've provided these as both a full day workshop. So we offered a full day workshop at the end of November, but then we also offered the program as a 3-session lunch and learn, to try and bring back that spirit of people coming together, sharing a meal, and having the opportunity to build relationships over multiple weeks of sessions. Between November and December of this year, we've offered 2 workshops so far. We've had a total of 20 participants. We had evaluations completed by 17. So we've gotten to get some initial feedback on how people are liking the program. So out of the people that completed our evaluations, 8 were care partners. Most of them were caring for their spouse living with dementia, still living at home. We had 4 professionals who we had a community agency reach out. They work with a person living with dementia in kind of a group care setting. So they wanted to complete the training with our staff. And then we had 5 people who just identified they have general interest in learning more about dementia. So the participant feedback we gathered, we did some post surveys after they had finished the workshop. So we asked probably about 7 or 8 questions. So I just wanted to share some of the feedback with you all. So we asked the question, because I took this workshop, I created new connections or strengthened connections with people in my community. Obviously, FCSS, that's one of our major outcome measures with any program we put on. 11 stated that they strongly agreed, 4 somewhat agreed, and 2 neither agree or disagree. What we did notice is that the participants in the lunch and learn workshops that met 3 times, as opposed to just the 1, more of them strongly agreed that they felt more connected to people in their community. I know that one of our participants, as our icebreaker, we asked, what would you do with an extra hour in the day if you had one? And he said he would play pickleball, and now him and one of our instructors play pickleball together. So we saw a lot of those connections happening primarily in those lunch and learn workshops, and a lot of that peer support that we wanted to see. Moving on to the next question, I have a better understanding of how to support the personal well-being of persons living with dementia. Most strongly agreed with that statement, or at least somewhat agreed. And then what I learned will help me in my role as a caregiver or support person. Once again, most agreed with that statement and most strongly agreed. So we're really happy with the feedback we gained so far. So just showing, I did some graphics here. I learned how to do charts in PowerPoint, so I figured I would grace you all with those. So yeah, really happy with the feedback so far. And then to wrap us up, with just some successes, key learnings, and then we'll move on to some of our challenges. So for the community education workshop, we really learned there were lots of opportunities to connect participants to other programs and services. So we noticed that a lot of participants who were already accessing, let's say, the adult day program or home care or the Alzheimer's support group were sharing those experiences with maybe caregivers who just recently their spouse received a diagnosis of dementia. So we saw an opportunity to connect people to other resources and services, and a lot of the participants were helping each other. We also noticed that through FCSS, we offer the Compass program, which is caregiver support group. And a lot of the people who participated in our education workshops were interested in then doing the caregiver support, because the Living the Dementia journey is more focused on the person living with dementia. We felt like that could that would really beautifully be supplemented with a more caregiver focused support group. We learned, particularly with these workshops, the value of paid advertising. So me working with youth and young parents, I typically promote on social media. However, newspaper ads really paid off on this one. And so we learned that to fill these workshops, that investing in newspaper advertising was very beneficial. And then, yeah, like I mentioned, the peer support and relationship building, we really wanted to bring the human component back through these workshops, because so many of our project activities kind of had to be at a distance. So this really brought that human element to our project. Challenges primarily was our timeline. We were a little late to the game getting started. So we kind of just had these 12 months to pull this off. And so just working out schedules of volunteers who are going to offer this workshop. Yeah, we didn't get the chance to offer more than 2 workshops, but at least we got these 2 in to get some initial feedback just in our first year. Ongoing volunteer and community partner engagement. So we just noticed that throughout the project, things have come up in people's lives. And so to get volunteers, community partners, members of our working group continuously engaged has just become more challenging with time. Our well-being guide, we had some challenges with this, primarily because it kind of felt like we were doing things backwards. We had already kind of decided that we'd like to use this particular grant funding for our volunteer training. So then we'd already kind of come to that decision prior to completing the well-being guide. So I thought that it could have been a very valuable tool, but I almost felt like, yeah, we were doing it backwards because we'd already almost decided what we wanted to come out of that well-being guide. And then broader public engagement, just because our community education, we really wanted to increase public awareness of dementia. So to increase compassion in our community towards people living with dementia. And this overview workshop, given that it's 8 hours worth of content, that's a big commitment for a lot of people. And so we've noticed that we likely should look into developing a shorter presentation just for larger groups that don't necessarily have the 8 hours to commit to something like this. And this is where I should have included a question slide, but that's the end of my presentation.
Thank you, Emma. That's great. That was a really fruitful presentation there. Lots of great learnings and special kind of moments that you shared with us about what occurred there. Just wanting to open it up to the group here then around if you have any questions for Emma and any discussion around that. Hi, Sharon. I see your hand there. Go right ahead.
Sorry, it was easier to do that than go for the hand.
You bet.
Just a comment as far as the living the dementia journey. We've offered it out here in Stony Plain a couple of times, and the last time we shortened it to 6 hours. Like you were talking about making it shorter, it worked because we shortened the lunch hour and we were able to get through in 6 hours, and people appreciated it being the shorter time. So it is possible, and you do get through all the stuff, and it is an excellent program.
Great, thank you, Sharon. Any other questions from the group?
Hi, Helen.
Hi, Linda.
My video isn't working.
That's okay.
And as you know, I was part of this group. and then I'll just tell the story. What happened while my husband and I were having Thanksgiving in Saskatchewan on Thanksgiving Monday, a cerebral aneurysm ruptured.
Oh,
So he had the coiling at the Royal University Hospital in Saskatoon. We spent from October 10th till November 9 in Saskatoon, came back to Westlock on November 9, and today is December 13th.
wow.
The procedure has left him with a vascular dementia.
Okay.
Being that I'm rather familiar with dementia, I started back with this group, I think 2018, with my initial interview by Lisa Basisti, because my dad had dementia. So
Right.
I've continued on with this group. I have a great deal of interest in it. And now I am the caregiver of a spouse with dementia. Just yesterday morning, he was moved from, for people that know the goals of care, he is now called the, oh my goodness, there's all these different, so
Yeah.
comfort care.
Right.
And I have
Okay.
to tell you, the difference between a C1 and a C2 is really the splitting of hairs.
Right.
So he's
Right.
considered a C2, but that may, who knows when he will depart, when the
Yeah.
angels will come with him. On
Mhm.
Saturday, I thought it would be that night.
Mhm.
By yesterday, he revived and he ate all his meals and had a real good visit with a friend.
Wow.
I have said for people to, if they have any last minute things, they need to deal that now. It's been a roller coaster.
Yeah.
I am so happy today to be able to be on the Zoom and to listen to Emma, because I have not been able to be part for the last several meetings. So today was really important to hear what our group did. And
Yeah.
I made use of that iPad,
Mhm.
and then I bought my own. And I
Oh,
was so
good.
happy I had my own during the
Yeah.
time we were in Saskatoon.
Right. Yeah.
There were many different, those long days in the hospital, I played several of those different games.
Good.
So
Good.
that was an excellent diversion for me. And occasionally I still sit back and do a bit of that, but not as much.
Right.
For community engagement, I myself, on October the 12th, my sister, retired pharmacist, Barhead, did a Zoom blog, and it was called
Mm.
Charlie's Journey to Recovery. So at first it documented about what was happening to him medically and all of that.
Mhm.
It has now morphed to Linda's blog, talking about the journey of dementia, about what it is like having a spouse with dementia, what it is like grieving, not being able to take him home, having to have the rye done, his exposure to the rye, what that is. And yesterday, he and I were able to have the conversation about why I couldn't take him home. And hopefully he could go to Smithfield Lodge, but it might be the nursing home. And he seemed to understand. And then by the time I left, he wanted his jacket again.
Right. Yeah.
I am hoping that this blog, I've got over 100 people on it from kind of all over. It is just to, people need not be afraid of dementia. Dementia happens, and let's not hide it.
Yeah.
Unfortunately, there's several people that I know that don't want people to know that their spouse has dementia. They're
Mhm.
fearful
Yeah.
of broadcasting. It's sort of like,
Yeah.
don't tell anybody.
Yeah.
Don't tell
Linda.
anybody. But whatever. So I've talked enough.
Yeah.
Just
You
wanting you to know where it's at.
Thank you,
Yeah,
Linda, for
thanks.
sharing
Thanks for
that.
sharing, Linda.
Yeah. And I think, is what you're describing there, especially about the blog, is really around that, building that community, and sharing with the community what what it's like, right from that person, from that individual experience. And that's really powerful. So thank you for that. And thanks for linking in that the iPad use there too, because I think that's a real innovation from this project. And to have got those resources that are useful to people living with dementia and for their carers onto that iPad.
I need to touch on the twiddle muff.
Okay.
So one day through the volunteer group, Charlie was given a twiddle muff.
Mhm.
I gave it to him. And he put his both hands in it. He was kind of cold, and he did the twiddling.
Yeah.
I took a picture, sent it to Teresa Bechtel because she's been part of this group.
Oh,
Yeah.
She said, "My mom crocheted that twiddle muff,"
Nice.
and Teresa had embellished it.
Nice.
So
It's all the
that's a
connections, right?
connection.
Yeah,
Yes.
all the connections. That's right. That's beautiful. Thank
Wow.
you, Linda.
Yeah.
Are there
If
other?
you want in on the blog, you have to become my Facebook friend.
Okay. Look for Linda Saunders, and then that will get in there. Thank you.
Thanks, Linda.
One thing I forgot to mention during the presentation is just as we're kind of wrapping up this project and doing all of our phone surveys, reaching out to everyone who's accessed different components of this project, we've realized that, yeah, it has really become a community, and there's people wanting to stay connected and wanting to keep talking about this. They're asking about, if they've accessed a sensory kit, they'd like to take the training. And so that's the one thing where it's almost like I wish we had more time, because I know that me having time to coordinate this project, like, it ends at the end of December, and it feels like we have such inertia right now. And so that's, just talking about sustainability and stuff like that, like you create all this excitement and all these people wanting to stay connected. And then, just not knowing if the resources are going to be there in the same way they were this first year of this project.
Right. Thank you, Emma. That is, a strong theme that we've heard across all the presentations so far, for sure, with it is how do we be working on that sustainability right from the beginning, and we need lots of different layers to help us work through that. That's for sure. Yeah.
And how do we share those challenges
Yes.
up to have to not have that reality of kind of grant to grant funding, right?
Mm-hmm.
How can we make this part of our regular way of doing business? So yeah, that's you're not alone, unfortunately, on that island, Emma. Yeah.
Emma, I had a question about your intergenerational learning. Have you received any feedback, especially from the younger people, but from any of the participants about the benefits of that? What I'm thinking of in another avenue, you told a story of at one of your community events, and kids ran up and something about, are you the dementia people or something like that? Anyway, I'm just wondering if you had any feedback about that intergenerational piece.
Yeah, it's been lots of like informal education, and I think what we've noticed is lots of kids know more about dementia than we thought they would. And like as we've gone out and done some community engagement, we had our dementia table at our community showcase, and our table was full of kids, not even people living with dementia, caregivers, seniors. Like, we just had kids at our table. So just taking those opportunities to provide just some informal education, ask some questions. So lots of the feedback has been very informal. But we've been very impressed that kids know more than what we think they did, and they're able to point out people in their lives that are living with dementia and how that presents. So it's just been more conversations as they happen.
Great.
Beautiful.
Chelsea, did you have a question? Did I see your hand up?
Yeah, I did have a question. Thank you. Thanks for the presentation, Emma. That was great. You mentioned, I believe I heard you mention something about caregiver information that you uploaded onto the iPads before you lent them out. Is that right? Yeah, do you, what caregiver information did you use? Did you use specific programs or sites?
So most, like, we prioritize like literature from the Alzheimer's Society. So most of the PDFs we have in that resource library are pulled directly from the Alzheimer's Society, I believe, of Alberta and Northwest Territories. So basically almost all the documents we put on there you could pull from their website. So more kind of just general information about specific topics in caregiving. And then we included a lot of their information just in terms of the stages of dementia, different types, stuff like that. And we've organized it all into folders, hopefully to organize the information into different topic areas for people.
Okay, great. Thank you.
Any, anything more for Emma or Westlock?
I had a question for Emma, just kind of personally, because I would see you as one of the young adults involved in this work. And I think it's really unique that you came with that background. And just wondering, what did you notice for yourself in terms of what you learned around, community involvement, dementia, working with older folks? Were there any things there that really stood out for you?
Funny, because I was absolutely terrified to do this because I'm used to 12-year-olds. And so adults kind of scare me a little bit, especially in terms of having to deliver this first community education workshop. I think, and even presenting at the seniors conference, again, scary for me because I've always worked with younger because I am young. And so, but one thing I've noticed is that seniors are exactly the same as kids. They just want to laugh and hang out. They don't want everything to be so serious all the time. And so I think that's been my main learning from this, is that people are just people. And so it's, I mean, and yeah, they want to feel supportive. They want to laugh. They want to have opportunities to connect. So I think that's been, I don't know if that answers your question, but that's been my biggest learning from all of this.
Yeah, I mean, Emma, I think that's beautiful because I think one of the big things we talk about is ageism and stigma related to dementia. That's exactly it, right? We're all people. It's all of us.
People.
Yeah, exactly. And so that really speaks to that experience. So thank you for sharing that. Yeah.
And that opportunity to connect, right? You mentioned that a couple of times in your presentation, just how appreciative people were of that opportunity to connect, right? That's a humanity part. Yeah.
And it
Beautiful.
really means that it needs to happen at that community level where people do connect naturally, and then building some of those out from some of those and creating some of those opportunities to connect, right? Yeah, it's so key. Yeah. Thank you.
We heard from Linda, and Lisa has a comment, but Lisa, anything to expand or anything from Tracy about being involved in this work?
I can just jump in, Lisa. I'm not sure if you unmuted yet. I think it's been, like Emma talked about, it's definitely been a whirlwind, right? Just rewriting the grant from scratch and then jumping in, midway, and then having to see everything through in a year. And it does feel like we're just getting going. So I know you guys have heard that multiple times, but I'm hoping we're definitely going to be keeping we have volunteers trained, so with the Living the Dementia Journey, so we will definitely keep some of that education piece going. So some of it we can maintain without having extra dollars. Even the iPad lending library, that's not going to cost us money to continue to do that lending piece of it. So some of it we will sustain, but just not at the level that we've been able to by funding Emma to be the coordinator of it. So that's going to be, yes, Emma's still around, but she will have other responsibilities. So it'll kind of be off the side of her desk as little bits and pieces. But yeah, so it almost feels a little bittersweet. We got the ball rolling, and now it's just trickling. But we're still thankful that we'll be able to continue it at some level for sure.
Yeah. Thank you, Tracy. Yeah.
And it's Lisa here. I agree with Tracy. It is kind of bittersweet. I've been involved with the project since pretty much day one when it was the dinner club and so forth. And it has been a great project for our community. And And you know, going forward, I think if we just continue on with what we're doing with our working group and they want to meet, I think that's great. The only thing is that we won't have Emma at the helm, even though she is, it'll be on the side of her desk. That makes it a little bit more difficult, but hopefully that can continue, because this community certainly is in need of it. I'm sure there's many communities that are in need of it, but we do have an older population here. And I guess on the other word here, we're hoping that Dr. Lewanchik is able to come and speak to us in the springtime, and that's what we're aiming for. So we're hoping to have that solidified soon enough.
Great.
Gee, you found I was spying on you.
Secret's out, Richard.
That's right.
What's that, video bombing or photo bombing type of idea? Yeah, yeah.
Yeah.
All right.
Well, great summary of the work there.
Yeah.
Lots of great stuff.
Well done.
Yeah.
Kudos,
Yes.
Yeah, great
kudos
job.
and congratulations. And it's been well worthwhile as on my part, if I can speak on behalf of the team, to have been involved and supportive of this as well. So great work. All right. If there's nothing more for or from Westlock, I will take over things here then, and I'll pass it to Helen and Sharon and Kate, but to discuss the wrap-up event.
Sure. Thanks, Shauna. That's great. Just wanting to remind people that to mark in your calendars for March 28th from 10:30 to noon Mountain Time. We are going to be having a wrap-up celebration of this Health Canada grant. And we're so lucky to have been able to connect with Cormac Russell from Nurture Development, a real international expert on community development, asset-based community development. So really looking forward to really great speaker. If you've ever had the chance to listen to him. So we'll be sending out a registration link in January. And if you've got any questions around that link or want the save a date that Kate had sent out, please just contact her there at her email address. Thank you.
Yeah, the Zoom room is big. So
Yes, yeah,
got
lots of room.
If anyone interested.
Yeah, just a note, you've all registered, of course, for this meeting series, and that will be, you know, the Tuesday. We're going to send out a separate link though. So the link that you're using for these partners meetings won't work for this one. So it'll be a separate link that I send out in January. And if you have any trouble with that, I'm happy to walk you through it, because there's always weird issues with Zoom, or so we found. So I'm happy to troubleshoot if anybody needs support.
Thanks, Kate. More to come on that. And thanks, Richard, while you're here, for the connection there. That was, you were a big part of fostering the connection there. So thank you.
Yeah. Yeah, great. All right. And then some information about our return on investment. And I'm not sure, this is back to you, Sharon and Helen.
Sure. Thanks, Shauna. I think we won't dive into it too much. I think the latest version of the return on investment has been shared as part of meeting materials. So this was just as for your information for those who might be interested, but we did have a return on investment completed back in 2020. And so this is a refresh of that. Suffice it to say, we're very fortunate to have a health economist supporting us to do this, because heaven knows that this would be a really difficult task for us to manage alone with our team. So suffice it to say that this type of work that's being done at that community level, and it's thanks to what we're learning from teams like the Westlock team and others that we've heard from over this meeting series. But there is good value in this work. being done. So, you know, if you have more questions once you've gone through it, please let us know. There is a link to the abstract of the article that was published in the Journal of Mental Health back in 2020 there. And if you're looking for a more fulsome article on that, we can absolutely share it. To add on to what we're learning through this return on investment, we're also in the process right now of doing work on a social return on investment, which looks at, rather than kind of that system level and healthcare focus, what is the value to society in this work? And I think we've heard threaded throughout the community presentations, the value to those living with dementia and carers in the communities on the social connection and the importance of just attending to our human needs. So more to come on that. We will expect that forecast social return on investment to come out in the new year, and we will certainly share it across the partners group. So let us know if you have any more questions on that.
Sharon, I'm just wondering if there's people on the line that this type of information is really new to. Could you just expand a little bit on what an ROI means? So there's a range here for every dollar invested. So is that for every dollar invested, this amount is saved or earned back, or what does that mean exactly for those that might not know?
So it's for every dollar invested by Alberta Health Services, that return of the value that you see here. And we can see, and I think, Emma, it's beautiful that, and Tracy and others that you spoke of, you know, just kind of getting that ball going on it. The longer this type of work is sustained, it seems that higher there is of return. So I think that speaks to the need to kind of attend to keeping these kind of pilot projects or grant funded projects working. So yes, at a very superficial level, it is that investment by Alberta Health Services, but recognizing then it's more focused on that healthcare system utilization component was the predominant focus of this ROI. Helen, anything to add there?
No, I think, you know, the low and the high value is a range that is part of the methodology of this. So that's why the two are in there. So if everything's maximized, then we get that high value. But if, and so we kind of think that it lands somewhere in the middle of those, but that's what we're working towards, is that high value part of it. Yeah. And that then to the social return on investment, we will see what is that value across different systems. So we're really looking forward to getting that information.
And the methodology is looking at, so kind of those statistics in Alberta of what would be the percentage of the population that might have dementia, and looking specifically then at the communities that have been involved in the Health Canada grant over the course of the last few years. So in those communities, looking at what that return is and how the decrease in healthcare system utilization, which includes acute care, unplanned emergency department use, and then as well primary care visits. There's also some information, as you'll see in the document, around prescriptions that are in there. So, you know, a healthcare slant to the return for sure, but more to come on the value in other places.
Thank you.
Yes, I see your comment there, Sharon. So you bet we can send that.
Resources to share?
I think
is this self-explanatory?
Well, I guess just where it kind of arose from is that we attended a webinar this week. It was put on by, it's a group in Ontario and hosted by the Elder Abuse Prevention Ontario. And the topic was really around interventions that have worked to combat ageism. The studies that they were referring to were a little more around individual types of interventions, but just out of there were a couple of videos that we thought really encapsulated and spoke to ageism and the impact on that. And so wanting to share the one from, okay, I think actually the top one is actually from the World Health Organization. The ageism is all around us. And then the Elder Abuse Prevention Ontario is the second one. And then the third one is from Help Age. So we just thought they were nice, fairly short videos that the teams may enjoy or want to share them as part of their events, if that's appropriate.
Great. So we'll just wrap up with another invitation to join us on CORE, and perhaps this is the best time, Peggy, if you're still on the line, perhaps give an introduction to the new platform, perhaps some of what the current members may have to do or what new members may need to may expect.
Thank you, Shauna. Yes, so we are moving into a new platform. The official launch will be in January. So CORE will look a little bit different. We apologize for all the hiccups that I think by now all the members won't have to sign again. That was a little bit hiccup. So all the members transferred to the new platform, and we are in the midst of transferring resources and videos and all of that as well. So it's gonna be looking a little bit different, but it has a lot of great possibilities. So we are really happy that it will provide opportunities to be a little bit more user-friendly as well. It makes more sense of how resources and events and toolkits are organized. It provides also the opportunity for members to chat with each other more directly and to post discussions and get notifications. So if you are joining a group like Connecting to People and Community for Living Well, you can get notifications and be able to see when there's new resources available from the group and events, etc. So please stay tuned. During this time, there's still a little bit more hiccups, and we are hoping that during the quiet months of December, everything will get smooth. But officially, we'll launch again in January. So stay tuned. Thank you.
Thanks, Peggy. All right. Any final, sorry.
Question from, just the question from Richard there.
Richard,
Richard's hand
sorry
up.
about that.
Yeah.
Go ahead.
Oh, I was just going to, you were about to say any final questions or comments, because I was going to offer a couple of comments. This is fantastic work. And so me saying fantastic work could just be a platitude, but actually this sort of work in Alberta is becoming internationally recognized. All the community development work. So kudos to all of you. So that's why Cormac Russell, would be agreeing to provide the speaking at the closeout. Just he's been working, I know, with City of Edmonton and working and very much aware of community development work in Alberta as well. And I don't know if people have heard of Peter Block, but he's a very well-known U.S. author who works in community development and the value and strength of communities. And he's aware of what's going on in Alberta. And he's told the U.S. Surgeon General's office, who is now aware and wanting to find out what's going on in Alberta. So that's all thanks to the work that you're doing. So great job there. And that absolutely is the future of health and wellness care. So as you've probably heard, people say, we don't have a healthcare system, we have an illness care system. Well, a reactive illness care takes place in buildings, which go by the names of, hospitals or long-term care facilities. When we failed, you end up in a building. So if we want to be wellness-oriented and health-oriented, where does that take place? It doesn't take place in hospitals and buildings. That's not where we do wellness. We do it in the community. So to Sharon's previous point, I am very busy looking for ongoing resource and more resource for this sort of work for you, because it's just so important and fantastic, which then leads me to the return on investment. So in government and AHS executive, you often hear about this return on investment. How much money are we saving? To which point you could say that the return on investment for treating cancer is absolutely zero. yet we still do it. Why? Because it's the right thing to do. So we're doing this because it's the right thing to do, not because we want to save money. The interesting thing is when we do the right thing, when we look after people and improve wellness and health in the community, as a consequence, we end up saving money. So that's sort of a side effect. We're not doing it just to save money. So we're really changing our perspective on this and looking at things like value-based care. What's the value of doing it? So the social return on investment is really, really important as well. And I sort of have one question, and this is my ignorance, but my job is professional connector. So in our health system integration, we deal with things like faculty of education at the University of Alberta and University of Calgary. And it's struck me for a long time that in First Nations communities, if you're to do one of those things, I'm sure you've done it on Zoom, you put up a word and then you do that word association thing. So if we were to do that with elder in a First Nations community, what would pop up? You know, you'd be sending out words like wisdom, experience, respect. And then if we switched over to our, I can use the Cree word, munyao, white person sort of communities and said older person or senior citizen, what sort of words would we get? I'm not sure we necessarily get the same words. So it struck me that it's really impressed with like Westlock and other communities that have involved the youth. So given we have, or our area has connections with the Ministry of Education, with the education faculties, there's a lot of education that's now takes place around First Nations in our schools and amongst the youth. I just wondered how much goes on about elderly and the aging process and whether there's an opportunity there to change our culture a bit around that. I can confess ignorance on that. So I don't know if anybody's aware or knows, but sort of to shift our attitude much more towards the First Nations attitude. Anyway, that's fantastic work.
Thank you, Richard.
Yeah, thanks.
Yeah,
What an inspiring way to wrap up.
yeah.
Thank you.
I
Go
think
ahead,
that
Helen.
also, I was just going to say, I think that really, as we look to the future in whatever vein we're able to, but that just opens up again that we need to go across our sectors, right? That it needs to be not just health, it needs to be social, community, education. It's boundless, but everybody needs to be kind of involved in this. Yeah. Thanks so much.
Great. Well, we will wrap up, and I suppose we'll take the opportunity to wish you all a very safe and wonderful holiday and Christmas, whatever you celebrate, even if it's just downtime. It's been a joy working with you in 2022, and I look very much forward into 2023. Anything else from the provincial team as we wrap up?
Oh, just thank you to everyone and happy
Thanks, everyone.
holidays. Merry Christmas.
Yeah, and thanks again to the Westlock team for sharing.
Yes.
Great. Okay, take care, everyone. Be safe,
Take care, everyone.
stay well. Bye-bye.